Ohio gozaimasu. Hi everybody. Today I will try to speak about as on the go or takeaway message regarding hepatic lesions or a patient who present with a liver lesion. A liver lesion means, or a lesion in generally means an area of damaged tissue, within an organ. It might be within the liver, we call it liver lesion, within the spleen, within the brain, within the lung, within any solid organ inside the human body. When there is an area of damaged tissue which is recognizable on clinical examination or on radiologic examination, we call it a lesion. It is an area of damaged tissue, and this might present as an abnormal growth inside an organ. Today I will speak about a liver lesion which presents as an abnormal growth within the liver, and we call it hepatic lesion. This hepatic lesion may be either solitary or that is single lesion in the liver, which is recognized in many cases on radiologic examination, to be more precise on ultrasonographic evaluation or ultrasound of the liver. Hepatic ultrasound will detect a lesion, and this lesion might be detected incidentally or accidentally, we call it incidental liver lesion, and it might cause clinical problems that is causing symptoms and signs, or it might be a symptomatic lesion which is just detected on incidentally on ultrasound of the abdomen done in the context of the evaluation of other clinical problems or patient presenting with other clinical problems which might be related to the liver or not related to the liver, or maybe related to the gut, that's the gastrointestinal system, or to other complaints of the patients, and then we accidentally discover a hepatic lesion. The hepatic lesion, in many cases, it is solitary, that is single, or it may be multiple hepatic lesions. This problem of solitary hepatic lesion is that the common question, is it something serious or it's not serious, doctor? This is number one. Is it benign or malignant? Does it need any intervention, or doesn't need an urgent intervention, for example, surgery? Or we can just put it under observation and observe the patient clinically over time. Generally, the solitary hepatic lesion may be either benign, and this is in most of the cases it is benign, and it doesn't need too much concern about it. It just needs to be investigated, and that is do, for example, liver function tests and evaluate the patient generally clinically, and then we reassure the patient that this is a benign lesion which doesn't need him or her to be much concerned or worried. And we put this lesion and the patient under observation, and just for follow-up and regular checkup or regular visits to the clinic with the doctor, who will observe the lesion and see the lesion, the size of the lesion, the shape of the lesion, any other new symptoms, any other new problems emerging in the case, and do regular liver function tests and general checkup of the patient and the complete blood picture and the SR and these things, and that's enough. If everything's okay, just we continue follow-up and regular clinical visits to the doctor's office, and then that's all. In most of the cases, they are benign, as I mentioned, and these are the more common. And the most common benign hepatic swelling or solitary hepatic swelling is hepatic hemangioma or focal nodular hyperplasia of the liver, or a hepatic adenoma. And this, for example, happens in sometimes the patient is born with it, like hepatic hemangioma, or sometimes it is due to the effect of some drugs, like what it happens in ladies who are taking oral contraceptive pills or estrogen-containing pills, they might develop a form of focal nodular hyperplasia or hepatic adenoma, which is a benign lesion within the liver, and it just needs follow-up of the case and reassurance of the patient. That's all. It doesn't need any surgical intervention, for example, or it doesn't need the patient to be worried about his or her clinical condition. So this is the benign hepatic lesions, hepatic hemangioma, hepatocellular adenoma, or focal nodular hyperplasia of the liver, which sometimes is, as I mentioned, the drug related, whether it is related to estrogen or related sometimes even to testosterone containing medications. So we have to observe the patient, and we have to do regular function tests, that is liver function tests, chemistry of the liver, and to do regular also ultrasound every 3 to 6 months to follow the size and or the size of the lesion and its shape and its location, and whether there are any other lesions developing in the liver, or it is the same status, solitary lesion without any increase in its size and without any associated or emergence of new symptoms, like, for example, abdominal pain due to rapid enlargement of the swelling, for example. By the way, if the patient shows pain or progressively enlarging swelling, causing a progressive enlargement of the liver within a short time, or if there is dangers or signs of rupture of the lesion or internal bleeding, here we might need surgical interference, whether an open surgery or transendoscopic surgery using the new techniques and the new procedures in which we use endoscopy to remove the lesion from inside, or we might need laparoscopy, or might need open surgery in some cases. So these cases might need surgical intervention if the lesion is rapidly enlarging in size, if it is associated with increasing abdominal pain, if there are signs of imminent rupture of the lesion or internal bleeding. These are the indications for surgery in such case. Otherwise, we should put the patient under observation and just observe the case clinically and by doing regular liver function tests and regular hepatic ultrasound. The less commonly, these solitary lesions, they might be malignant, and the most common, of course, is the hepatocellular carcinoma, presenting as a solitary lesion in the liver. In less common cases, might present as a multifocal pathology within the liver. That is, it presents as multiple foci within the liver, and this is multifocal hepatocellular carcinoma. So it might present as a solitary lesion, single lesion in the liver, or it might present as a multiple foci or multiple lesions. This is what we call multifocal hepatocellular carcinoma within the liver, which might, of course, metastasize to other organs in the body later on. So this is the other possibility of a solitary hepatic lesion. It might be less commonly hepatocellular carcinoma, that is malignant tumor of the liver. And it might present, as I mentioned, as a solitary lesion detected on hepatic ultrasound, or it might present with hepatomegaly, or it might present with jaundice, or it might present with other abdominal abnormalities, or in late cases features of hepatocellular failure or even ascites and distant metastasis, or it might present even with paraneoplastic syndromes as a possible presentation of hepatocellular carcinoma. But at the beginning or in the early stages, it might just present with a solitary lesion in the liver, especially in patients who are at risk for hepatocellular carcinoma, like, for example, people who are having hepatitis B or hepatitis C, and they get chronic hepatitis B or chronic hepatitis C. These are pre-malignant conditions, and they are predisposing to the development of malignancy within the liver, that's hepatocellular carcinoma. So cancer might be a possibility of we put it as a possible differential diagnosis in patients presenting with solitary liver lesions. Other causes of solitary liver lesions, for example, other than tumors, we have hepatic cysts, for example, hydatid cyst in the liver was a common, although rare, site for hydatid disease inside the human body, and this is a parasitic disease. It's well known, a classic idol in the history of medicine. So we can just put this possibility in mind also in the differential diagnosis of a solitary hepatic lesion. It might also be multiple, not only solitary. It might present as multiple lesions in the liver, prove to be hydatid disease of the liver, which may even rupture into the lung, or the reverse. That's the opposite. That's the hydatid cyst in the lung rupturing through the diaphragm into the liver. That's another possibility. And this is the classic hydatid cyst in the lung, causing what we call anchovy-sauce sputum and positively sign on X-ray of the lungs. So a parasitic disease, or parasitosis, to be more specific, hydatid disease. Also cysticercosis might present as related to tinea solium, might present as a cyst in the liver, or might present as a cyst in the lung, or even a cyst in the brain, causing an intracranial space-occupying lesion, which is cysticercosis. So cysticercus cellulosis, it might present as a solitary lesion in the liver also, or in the lung, or in the brain. These are sites of cysticercus. Also, other possibilities which might cause solitary lesion in the liver, for example, amoebic liver abscess was a classic example in all the medicine, or in some era when we used to meet amoebiasis outside the intestine, extra-intestinal amoebiasis. One of its sites is in the liver, the famous, at one time, the famous lesion of amoebic liver abscess. So a liver abscess might present, whether it is related to a bacteria or related to biogenic liver abscess, this is biogenic liver abscess, or related to parasites like the amoebic liver abscess. So amoebic liver abscess is or was a common lesion in the differential diagnosis of solitary hepatic lesion. So these are all possibilities, or also might be related to other conditions like hemochromatosis, like which is a hereditary metabolic disease, which might involve the liver, or might be related sometimes also to autoimmune liver disease. So these are all possibilities of pathologies which might present with solitary liver lesion. So this is my talk today about what is liver lesion, solitary liver lesion, and these lesions, when it presented clinically, we just need to thoroughly, number one, take a proper history. That's patient's interview and history taking. And also, number two, to thoroughly examine the patient, physical examination, general examination, abdominal and gastrointestinal examination clinically, to detect the size of the liver, the size of the spleen, the peritoneum, any ascites, any signs of portal hypertension, any signs of chronic liver disease, any signs of chronic liver failure. On general examination and on local examination, any hepatomegaly, that is abdominal swellings, any splenomegaly, as I mentioned, any signs of portal hypertension on abdominal examination. Jaundice, of course, other signs of general signs of chronic liver disease. This is the on physical examination, and then we proceed to laboratory examination, including the CBC and the ESR, number one, and then liver function test profile, or the hepatic panel, to do the AST, the ALT, the alkaline phosphatase, the 5-nucleotidase, other serology of the liver. Maybe we have to do also hepatitis markers. Maybe we have to do immune profile and serology for immune-mediated disease, including the anti-nuclear antibodies, the antimicrosomal antibodies, the other markers for an immune disease involving the liver, whether it is organ-specific or non-organ-specific immune disease involving the liver. So these are all on laboratory, and then we do ultrasound to see the image of the liver and to find the exact pathology and whether it is solitary lesion or multiple lesions, and to see other features of liver disease on hepatic ultrasound. Sometimes we have to do endoscopy in some cases also, or to proceed to CT scan, computed tomography, which is contrast enhanced. So with contrast and without contrast, also MRI examination might be necessary in some cases to follow up the case, especially if the condition is suspicious of having, for example, malignant tumor in the liver. We might proceed for other investigations to detect the exact pathology, which is very important. We might need also liver biopsy, which may be transabdominal or which may be transendoscopic using endoscopic ultrasound and biopsy of the liver lesion to examine the tissue and to confirm or to exclude the presence of malignancy. Because if there is no biopsy, no cancer. So biopsy is very important by any route, transabdominal or transendoscopic. And this is to reach to for confirmation of the pathology of the hepatic lesion detected. So these are all investigations. If there is nothing detected, we can just put the patient under observation, and as I mentioned at the beginning, and for regular clinical checkups every 2 or 3 months, depending on the case, which varies from patient to patient depending on his age or her age and the presence of other comorbid conditions and the nature of symptoms, which are of course variable and different from case to case. So the exact management will be individualized according to the concept of what we call precision medicine or personalized treatment. Each case is considered individually for taking the proper clinical diagnosis, and the decision varies, and we have to reach to the right decision for the right patient in the proper or in the right time. So under observation is the art of medicine in many of such cases, especially in benign solitary liver lesions, which do not appear to have any other features of being malignant or threatening the life of the patient. So we just observe the patient, reassure, because many of these hepatic lesions, they do not need much concern, and many of them are benign and not malignant. Thank you so much, and have a nice day. Professor Tarek Ali.